Good morning, all. Welcome back to FECAM's unique histology review series. This video is brought to you by the academic and editorial boards of the Federation of Catholic Medical and Dental Students, FECAM's unique chapter. My name is Oguchukwu De Victor, a 500 level medical student of the College of Medicine, University of Nigeria Teaching Hospital, Itukwuozala, Enugu State. I am the current academic secretary of FECAM's unique. Special thanks to our alumni, Dr. Obu Andrew Chukwuemeka, who compiled this slide that we use to teach, Dr. Akinola Busayo, who set the pace for the actualization of our YouTube channel dreams, and to the House of FECAM's unique in general, led by our president, Ukweze Emmanuel Onyedikachi, for the support and encouragement throughout the course of production of these videos. And most importantly, special thanks to Almighty God for His grace and goodness so far. Please do not forget to like our videos and subscribe to our channel, as this will go a long way to encourage us to make more educational contents like this. So today we are going to be discussing about the histology of the esophagus and the stomach. So before we proceed, I will highly encourage you to review our former videos on histology of epithelium, connective tissue, blood vessels, muscles, etc., as the understanding of those previous videos will enable you get a hang of what we'll discuss in the recent videos better. So what should we be expecting from the slide guide compilation? What is new? Number one, more images that are clear and consistent with the slide markers, reasons for ID. 2, schematic diagrams for illustration of concepts where need be. 3, comparison of some lookalike slides in a single frame and their differences outlined. 4, spatial stains of some slides as stated. 5, overall explanation of why the slides are identified as they are. This reduces the need for cramming. 6, the key reasons for identifying some slides are specially pointed out on them. 7, orderly arrangement into systems for holistic approach and understanding. 8, and many more things you'll discover as you dive into it. Happy studying. Acknowledgements. The sources of our images includes the OMSA Histology Guide, compiled by Dr. Iferiki Igwe, Victor Chidera, Google Images, and various histology slides repositories online. This guide is simply to help you understand the dynamics of the pink and purple images as it relates to anatomy. Now let's go straight to what we are meant to discuss today, which is the histology of the esophagus and the stomach. So the esophagus. So the esophagus is a muscular tube that extends from the pharynx to the stomach. So generally, the gastrointestinal tract has 4 layers. It's structured in 4 layers. And these 4 layers form the basic structure where the differences in the different parts of the digestive system is seen. Remember the popular saying in anatomy, structure determines function. So the different parts of the gastrointestinal system will have different functions based on the type of structures that you find in its wall. So the four walls can be remembered with the acronym MSMA. MSMA. So the first M, which represents the mucosa. The second M, the S, which represents the submucosa, which is a layer of connective tissue. Then the second M, which represents the muscularis externa. And then the A, which represents the adventitia or the serosa. So the mucosa has three layers. So the one closest to the lumen is the epithelium. So the next one is the lamina propria, which is a layer of loose connective tissue. And then muscularis mucosa or the muscularis interna, which controls local movement in the epithelium. Then the submucosa, just like I've said, is a layer of loose connective tissues that contains blood vessels, nerves, and in some areas of the small intestine and also the gastrointestinal tract in general may contain specialized structures like lymph nodes, glands, etc. Now, the muscularis externa in the gastrointestinal system is mainly smooth muscles, and it has an inner circular layer and an outer longitudinal layer. There are a few exceptions, like in the upper part of the esophagus, where you find skeletal muscle, and then in the stomach, where you find three muscle layers, which the innermost one is the oblique muscle layer. So, but then the general structure of the muscularis externa is the internal circular muscle layer and the outer longitudinal muscle layer. Now, the adventitia is also a layer of connective tissue that surrounds the muscle. Now, in organs covered by peritoneum, the name of the adventitia changes to the serosa. So now let's read the side notes on how to identify the esophagus. So the reasons for identifying the esophagus are the esophageal glands in the submucosa, 2, the non-keratinized stratified squamous epithelium. Then the functions of the stomach is passage of food from mouth to the stomach, and the length of the stomach is about 25 cm. There's this acronym that you can use to remember lengths that are 25 cm, and the acronym is ESUD, ESUD. The E, which represents the esophagus, the S, which represents the stomach, the U, which represents the ureter, and the D, which represents the duodenum. So you should take note of the acronym. So the esophagus develops from the foregut, then pathology, esophagitis, tracheoesophageal fistula. So in UNTH histology steeplechase exams, pathology of the different organs are not mainly tested. It is mostly reserved for clinical classes, but then it's still possible that you could be asked. So never say never. And remember that no knowledge is a waste. So in UNTH histology steeplechase exams, you are mainly tested on your knowledge of reason for identifying the different organs, the functions, the development, lookalike slides, and so on and so forth. Mainly the things that you see in the side note. So you should take note of that. Now, let's zoom in into the slide of the esophagus so that we'll appreciate the features that we've mentioned so far. Okay. So this is the slide of the esophagus. Now, this is the mucosa. And the mucosa is a stratified, squamous, non-keratinized epithelium. So this epithelium is seen in areas which handles frictional forces. Like I said, I encourage you to watch our earlier videos on epithelium, connective tissues, and so on, as it will enable you understand these videos better. So this is the epithelium. Now, just deep to the mucosa is the submucosa, which is a layer of connective tissue. So if you look at the submucosa, you can notice that it doesn't really appear homogeneous. You can notice some thick staining areas, areas that surrounds the esophagus. So this represents the esophageal glands. Remember, it stains like this because of the presence of cells of the esophageal glands. Not that the connective tissue doesn't contain cells. It does contain cells, but the cell components appear scant in regular connective tissue. But that of the esophagus, you can see clearly staining structures. These ones, so they represent the esophageal glands which secrete mucus. Now, in some areas of the esophagus and generally the gastrointestinal tract, you might find some aggregates of lymphoid tissues, though they are solitary and isolated in most parts of the gastrointestinal system, except in a specific part of the small intestine and also a specific part of the large intestine that we'll review later. So the submucosa here does not appear homogeneous. You can appreciate some deeply staining areas, which represents the esophageal glands in the submucosa. You can appreciate that. So it doesn't appear scanty and homogeneous. It's not homogeneous. So the next layer is the inner circular muscle layer, and then the outer longitudinal muscle layer. See that? And then the adventitia. So the lower part of the esophagus, where it opens to the stomach, contains the adventitia. There it's called the serosa because it is covered by peritoneum. So now let's look at the next images. Look at this also. You can appreciate the epithelium, the mucosa. You can appreciate the submucosa, which doesn't appear homogeneous here. Here stains very well, which represents the glands. Then here stains poorly. Then the inner muscle layer, circular muscle layer, the outer longitudinal muscle layer. Notice how the muscle layers are well arranged and well organized. Same thing here. You can appreciate the epithelium, and then you can appreciate the submucosa. Notice some deep staining areas. So the submucosa here does not appear homogeneous. Notice some deep staining areas within the submucosa. So this also, which is the inner circular muscle layer and the outer longitudinal muscle layer. Okay, we've seen this image before. Now, sometimes people might mistake the ureters for the slide of the esophagus. So they actually kind of look alike on histology images. So let's try and differentiate between them. Okay, so let's try and compare the two slides. So for the ureter has three major layers, unlike that of the esophagus that has four. So the layer closest to the lumen is the mucosa, then followed by the muscular layer, and then the adventitia. So the similarities between the ureter and the esophagus is that they both contain a kind of stellate lumen, though that of the esophagus is not really exactly stellate. So the stellate lumen here is as a result of the longitudinal folds of the mucosa. Now the differences between the esophagus and the ureter is that the esophagus contains stratified squamous non-keratinized epithelium, but in the ureter you see the transitional epithelium, or what is also known as the urethelium. So try and refer back to our earlier videos on epithelium to understand how some of these epithelium look like. Then this deeper layer that looks like the submucosa in the ureter is not actually a real submucosa. It's not a real submucosa. So it's actually the lamina propria, which is a part of the mucosa. So it looks like the submucosa. If you are comparing with the esophagus, it looks like the submucosa. So this area appears homogeneous. Remember, the lamina propria is a layer of connective tissue. Loose connective tissue can find blood vessels. So look at how homogeneous here appears. So it looks like the submucosa in the esophagus, but it's not the submucosa of the ureter. Notice how homogeneous it looks. Now these circular dots, which are scattered, represents the blood vessel. Remember, in the esophagus, you can see a deep staining area which surrounds the mucosa, and it represents the esophageal glands, but here you can't see anything like that. This area appears very homogeneous. So now the next layer is the muscle layer. So for the ureter, you have an inner longitudinal muscle layer and an outer circular muscle layer. Now, one of the major things that will help you to differentiate the esophagus from the ureter is the presence of this extra layer of connective tissue, which is the adventitia. So in the ureters, it is very much pronounced. So in most slides of the ureters, you see a huge amount of connective tissue, which contains some fat cells. So these white spaces, then these small circles represents blood vessels. So it helps to anchor the ureters to the posterior abdominal wall. So in most slides of the ureters, you see this. So I hope you understand the explanation, as this will help you identify the slide of the ureter on histology images. The same thing here. You can appreciate the epithelium, the stellate lumen, and then the homogeneous looking lamina propria. It looks like the submucosa in the esophagus, but it's not the same. They appear similar, but it's not the same. Now the muscle layer, and then the extra connective tissue layer, though the fat cells are not prominent here. So in most slides of the ureters, you will likely see this extra connective tissue layer. In addition with the stellate lumen and the epithelium. So this can help you. Same thing here, not the epithelium, the homogeneous appearing lamina propria, which looks like the submucosa in the esophagus. then the outer muscle layer, and then the extra connective tissue layer. So in most slides of the ureters, you will see something like that. Same thing here. The epithelium, the stellate lumen, the lamina propria, the muscle layer, and then the extra connective tissue layer. Same thing here. See the extra connective tissue layer, the stellate lumen, and all the features we mentioned before. So that's it for the comparison between the esophagus and the ureters. So I hope you understand the basic differences between the two now. So in the esophagus, in most of the slides, you will not find the extra connective tissue layers. So in this case, you can find the adventitia here, but then the mucosa and the muscle layer, and then the submucosa clearly differentiates it from the ureters. Same thing here. You can find the extra connective tissue here. You can see some of the adventitia, but it's not as pronounced as that in the ureters. And then you can also see the other features of the esophagus, which will help you differentiate. You can also see the submucosal glands. You've seen this image before. You can also see the epithelium. So this will help you differentiate the esophagus from the ureters. Now the next one is the stomach. Let's read the side notes. The reasons for identifying the stomach includes the gastric pits, then parietal cells or peptic cells. So the structure of the stomach appears similar to that, the general structure appears similar to that of the esophagus, but then the striking things about the stomach is found in the mucosa. So the major features that will help you identify the stomach on histology images is the mucosa. Now the stomach develops from the foregut. The length is about 25 cm. The pathology is gastritis and so on. The functions is temporary storage of food, secretion of HCl, absorption of alcohol, and some drugs. So parts of the stomach, the cardia, the fundus, the body, the corpus, the antrum, and then the pylorus. So the stomach on histology images appears a kind of comb-like. I believe most people have seen what a comb looks like. So the mucosa of the stomach mostly appears prominent on histology images. So it's one of the things that gives the stomach away. So the mucosa is lined by simple columnar epithelium, which is adapted for digestion and absorption. So the functions of the stomach is due to the presence of the epithelium that you see there. Now, at this upper part, you get the gastric pits, and then at the lower parts of the mucosa. So this is also part of the mucosa. So this area from here to here represents the mucosa. So the epithelium, the simple columnar epithelium around the side. So all the cells are simple columnar epithelium. Then the gastric pits are located at the upper parts of the epithelium. Then the gastric glands at the lower part, and the gastric gland, they opens into the gastric pit. They pour their secretion into the gastric pit. So the cells that you can find in the gastric pits and the gastric glands are the parietal cells, which secrete the intrinsic factor and HCl. And then the chief cells. So the chief cells most times they stain better than the parietal cells. So the chief cells, they secrete enzymes that digest proteins. So they stain better than the parietal cells. So that's the thing that you must know. Now, okay, let's look at other slides of the stomach. Let's read this note. Take note of the comb-like structure of the stomach. Just like I've said, the pointed parts will help you specify the reason for hiding. If the arrow is at the base, chief cells as your reason for hiding. If the arrow is at the top, parietal cells. So remember what I said before about chief cells and parietal cells. So most of the parietal cells are closer to the gastric pits, which are the upper parts, of the mucosa. So if they are pointing at the upper part of the cell of the mucosa, your main reason for identification should be the presence of parietal cells. But then if your arrow is pointed at this lower part for UNTH histology steeplechase exams, your main reason for hiding will be the presence of chief cells. So the area that is pointed will guide the response that you give. So look at the epithelium here as well. Notice how prominent it is. Comb-like, appears comb-like. The muzzle layer is not really distinct. Remember what I said, the muzzle layer contains an inner oblique, then a middle circular, and then an outer longitudinal muzzle layers. So it also contains a submucosa, but those ones are not really remarkable here. You can't really appreciate much of them here. Then the muzzle layer is covered on the outside by the serosa or the adventition. So that's it about the stomach, the histology of the stomach. So this is where we are going to stop for this lecture. Drop your comments and contributions in the comment section. In the next lecture, we'll be looking at the histology of the small intestine. Thanks for watching.